ahead and put on the record option, and we'll check and see. It sounds like there's a little noise in the background. So I'm gonna mute everybody initially. Let's see if I can do that. I'm gonna mute everybody. And then if you wanna speak up, you can raise your hand or you can unmute yourself and say, hey, we're interested in talking. For right now, maybe we could talk and see if there are any new members in this class. Someone who hasn't been to any other classes here that Scott and I have been doing. Maybe it's your first time. We're just kind of curious. You don't have to tell us your whole life story, but we're curious how you found out about the classes and you know, whether it was a doctor or a friend or whatever, and then maybe what you hope to get out of the classes. So anybody care to share who might be new? You can just kind of unmute yourself, or you could raise your hand. And I'm looking to see if there's anybody in one field screen. I see a couple new names, but we understand that people can be kind of a little shy. And that's okay. There's nothing that says you have to speak up.
Looks like Shirley's got her hand up.
Where's Shirley?
Unmute
Okay,
yourself.
Shirley, there you unmuted. Good job. Okay, tell us. Hi.
Hello. Well, I went to see my physician, Amanda, at the time was Desinger, and who is now the O'Hara. And I weighed in at 192 pounds, and she just kind of looked at me and asked me what I was going to do about that, and reached behind her and gave me a flyer to the classes, which were held in a church 2 blocks from my house that evening. And it was like a real sign. So I went through the whole session. I loved every single one. I value and appreciate them. And I'm still using that information. And so right now I'm combining what I learned in those classes with MyFitnessPal and recording everything I eat and doing my best to stay 100% plant-based.
Nice.
Nice to see you again. It's been a long time.
Thanks.
Thanks for sharing that with the class. We're very happy to have you. Anybody else have anything they want to add?
Could I say something to Shirley?
Of course.
Hi,
Beth.
this is Beth. I'm part of a group that Chef AJ has called Feel Fabulous Over 40. And sorry, the light's really bad here. It deals with weight loss. And it's a really, really supportive group. And if you want to check it out, it's called Feel Fabulous Over 40. And it's like $1 for the first month. And then if you like it, then you can either do monthly, which isn't that bad, or you can do a year, which is really, I don't find to be too expensive, and I don't have a lot of money. So I think it's an excellent, excellent group.
Well, I thank you for the information. I travel extensively. So the reason MyFitnessPal works for me so well is because it's on my computer and I don't have any commitment. So I can appreciate, and I thank you for your invitation.
Yeah, it's all on Zoom and everything's recorded. So
Okay.
yeah.
Right. Thank you.
Yeah. Diane, I think, had a hand up, and Dave.
I'm Diane, and I heard about this from David. And
I heard about it from Nikki about 2 years ago.
Well, that is great. We love that people who have come to the classes and you share with others, and that's what we're hoping will happen.
I shared actually with another friend of mine, Deborah. And I don't know if she's been coming, but
She has been coming.
she has. Okay. Anyway, so I've been thinking a lot more about what I put in my mouth.
Great. And that's the purpose of the classes. We share the science with you, and then you decide what you choose to do. And that's a wonderful way of putting it, thinking a bit more about what you're putting in your mouth.
Thank you.
Welcome. Anybody else?
I had a question.
Go ahead, Lynn.
From last time, I really got it with calorie density and realized why I'm still fat. And I'm going for the that 400 to 800 with 30 to 60 minutes of exercise every day, because that's easy for me. I'm confused. I also am going to have another easy question. Well, my other easy question is just, I make homemade kombucha. I make ginger turmeric and ginger blueberry. And does that fit in at all to this, or do I have to give that up? And my other question is, my main question is, with the calorie density I want to do to achieve weight loss, I looked at the graph and it was a little confusing because it's weight, and I don't know what things weigh. I don't have a scale. What was confusing is the things that are not green light, that are in used moderately. I don't know how much of them I can use, and those things would be tortillas, whole wheat bread. And I've been making really yummy like stews and salad dressings with cashews and tahini as part of the mix. So that's obviously a lot of calorie density. So I don't know, like, how much does a slice of bread compare, weight density wise with whatever I'm eating? Like, how much a day or a week or whatever can I eat?
Scott,
Yeah,
you want to take
sure.
that?
Sure. So as far as the kombucha, I think that would be probably fine. There's not Dr. Greger has a video on kombucha. I mean, there has been some cases of lactic acidosis, which is it's pretty rare, but it's an acidic condition that's not good with kombucha. But that was commercial kombucha, not homemade, but I believe. But I've never had it myself. Maybe Charlie can speak on that after I'm done with the other part of the question if he knows more.
Yeah.
As far as the calorie density goes, what I would say is, and Charlie's mentioned this, I think he mentioned this last week too, which is a good point, is that if it's kind of a condiment or a piece of a recipe, things like tahini, which would be, it's just ground up sesame seeds, which is pretty high in calorie density. Maybe a handful of nuts in your salad or in a soup or something, or some seeds, those are high in calorie density. It's just a garnish or a condiment, like a tiny bit of the food, then you're probably okay with a little bit of that because the volume of that is so small. But you look at that calories per pound, you're never going to eat a pound of bread or a pound of tahini or a pound of nuts if you're just kind of sprinkling it in whatever you're eating. But if you're eating a tortilla or a piece of bread, that's actually a food. That's actually something that it's not really a condiment or a sprinkling or just an ingredient in a recipe. And so you might want to avoid those kinds of foods that are high calorie density in that yellow light range until you've reached your weight loss goals. Now, if you get down to your ideal weight that you want and you're exercising, and then you want to have a little bit of bread or a tortilla now and again, that would probably be fine. It just kind of depends on you, your own health goals, your weight goals, your overall activity level, and things like that. So mainly you'd want to just stick with those green light foods because those are all going to be 500 calories a pound or less. So you keep you into that, that 400 to 800 range, like you're saying. That 400 to 800 range is a range, and so that kind of allows for you to have those sprinkles, a little bit of dried fruit in your oatmeal, for example, or the tahini that's in that recipe, or kind of that gives you that little bit of wiggle room. Whereas if you're eating mostly potatoes, sweet potatoes, beans, intact whole grains, fruits and vegetables, you're going to be floating around that 400 to 500 calorie a pound range. And so then that's where that little bit extra, because you don't ever have to weigh your food. It's kind of the whole idea of calorie density is just to kind of have a ballpark. Oh, I kind of understand how many calories per pound these different foods are, these categories. And then you kind of, if it's less than 500 calories a pound, I kind of can eat as much of it as I want. But if it's above 500 calories a pound, then you're going to be kind of going, well, is it a food that I'm really eating as part of my meal, or is it just a little sprinkle or a condiment or ingredient in a particular recipe? Does that make sense?
Go ahead and unmute, Lynn.
It makes sense. I don't know if I can do it. I'm so used to having a piece of toast with my soup or salad or something, or tortilla with beans, corn tortilla with beans, and stuff. So, and can I just not do like Forks and Knives has a mushroom barley stew that I've been eating that feels really healthy, and I add kale to it, but it's got like the large pot of it has half a cup of cashews in it.
Yeah. I mean, I guess, just to mention again, things like bread, could be a healthy choice. It's just that's a decision you get to make. And I guess what we would just say is kind of, do what you're doing. And if you're not getting the results you want, then just look at ways you can lower that calorie density. Watch that Jeff Novick, that full hour, 19-minute lecture that's on the website. Watch that again and go, okay, because you can kind of, rob Peter to pay Paul, so to speak, right? So say you have that piece of bread, and you have that half cup of cashews in that recipe, in that stew or whatever, but then, I'll like Dr. Greger says in his How Not to Diet book with his 21 tweaks, you can kind of preload with negative calorie foods. So you eat like 100 calorie a pound salad before your meal. You eat some vegetable soup that would be 100 calories a pound or less before you eat the main course. And then you might not be as hungry to eat as much of the little bit higher calorie density food. So there's lots of other tricks and things you can do to maybe achieve your weight loss goals, even with still having some bread and a tortilla or whatever, like you're saying. But again, those are choices you get to make. You get to kind of do your own experiment and see how, just kind of do what you want to do and see how you do. And then if you aren't making it to your goals, then you can just, okay, let's see what can I tweak now? Just kind of use that as a rule of thumb.
Do you guys just never have bread or tortilla or anything?
I do, but I'm already at my ideal weight, and I've been at my ideal weight for 9 years, so I don't really have to worry about it too much, and I exercise quite a bit. So yeah, I still eat tortillas, and I don't eat bread very often, but once in a while I eat a tortilla, but not as often as I used to. Back when I was riding more miles, like in the summertime, if I'm riding like 100 miles a week or something, then I get hungrier and I have to eat a little bit higher calorie density foods, because maybe I don't have time to eat as much volume of food as I need to satisfy my hunger. So then, I might have a little, peanut butter on a tortilla or something because I'm really hungry. I just rode 50 miles. I want to eat a little bit more, get more calories in or something, so that's a good problem to have, I guess, when you're exercising a lot. You can choose a little bit higher calorie density foods. You have that luxury. But
Okay.
I've heard your statement before that I just can't see going without eating bread ever. I understand it. I've heard that from a number of people who were smokers, longtime smokers, that there's just no way I can give up smoking, and that something occurred in their life that they focused on that allowed them to stop introducing poison into their body. And I know that our culture does not look at bread as a poison, but like Scott said, if you're not getting the goals that you want, if you're not getting the weight loss, you're not getting down to your ideal weight, thinning the medicines, then at some point you may say to yourself, am I willing to do an experiment on my body to try this for a couple months and see what happens? And it doesn't mean I can't ever go back, but I'm just kind of curious with my body. If I choose not to eat this for 4, 6 weeks, 8 weeks, and I find that all of a sudden I'm losing weight, am I going to keep doing it, or am I going to say, well, I really want what I'm used to eating more, and I just am not going to do that? So
It's like
that's what
I'm already giving up. I give up. I don't put any Earth Balance or any, I don't do any of the oils or anything. I just have a dry piece of whole grain toast.
So why did you quote give those oils up, the Earth Balance? I mean, what was the motivation
Oh,
for
because
that?
I was gluttonous with it. I loved Earth Balance. I would literally just when I really wanted to eat late at night, just Earth Balance and toast, basically. So I mean, I was eating way too much. It was obviously, it
And
was
how is that
obviously,
going to affect your health, eating way too much?
well, I was gaining weight.
Yeah. So it's the same issue. If you can't lose down to the weight that you want, you may be saying the same thing to yourself about the processed foods, and bread is one of the processed foods that you're choosing to eat. It's something that it's a choice you get to make, and you've made the choice about these other things that you really liked. One of the things that I've found over the years is for people who keep using the words, I'm giving up, I've had to give up, it's really taxing on the brain. You don't get a good feeling, but if you really focus on the goal you want for yourself, and you talk to yourself like, I've been choosing foods that are going to really bring me to my goal, that are going to give me my health. That is what my mind is going to keep telling me over and over again. Which foods are really going to help me achieve my goal? I am not going to waste my time on thinking about what is not healthy for me. I am going to really focus my attention on making it to my goal, making healthy food choices, and not drag myself down to this black hole of I'm giving up the things in my life I like. I thought about that briefly, and I did this for my wife. And I stopped thinking about, oh, I have to give up this and that. And now it's 11 years later, and I love what I'm eating. And I hope that the same thing happens with you.
I'm trying to find ways that I can eat forever and not have it be a diet. And I don't know if I can give up bread forever. That's the thing.
And if you think about this, Scott said you don't have to give it up forever. He eats bread occasionally. I don't generally eat bread, but I could if I wanted to. I'm just currently choosing not to now. Occasionally I might eat a Ritz cracker, not a Ritz one, but it's a rye cracker. I don't know. It's not rich as I think you know what I mean, those
I
rye.
do. Yes.
I can't remember the name right now. Occasionally I would eat some of that with a little peanut butter, but you also need to be truly careful of the nuts. Remember, a quarter cup of nuts is 150 calories. It's about 10% of your daily fat intake. When you're eating a whole half a cup of nuts, you're getting up to 20%.
Well, the half a cup was for making a whole large pot of this stew.
Okay.
That it would take, that would be like 8 servings.
Okay, so as long as you're not, piling it on, it probably is fine. And the kombucha, I agree, it's probably fine for you. It has some probiotic stuff, which you would get from just being plant-based anyway. So it's not a requirement, but if you enjoy it, it seems like it's not an issue at all. And I guess we have 4 hands that are up, so we will get back to it. This is not an issue that necessarily needs to be solved right this evening. You have time, And don't be hard on yourself if you continue to eat like you want to eat. But give a little thought to the fact of what words you're talking when it comes to whether you're giving up something versus whether you're choosing foods that are really going to bring you the goals that you want. Okay, Ken next, and then Velvet.
Gotta unmute Ken. You're muted, Ken.
Still?
Oh, there you go.
Well, you're one more push to unmute.
Now,
Okay, yeah.
as you know, I'm particularly concerned of eating enough protein due to my therapy that causes muscle reduction. And so I've got two doctors that say I need to eat meat, 3 ounces a day of chicken or fish, but I'm resisting that. And I'm finding sources of protein in plants. Of course, beans are awesome in what they provide. But I'm discovering things. I love these hemp seeds. They're really good on salads or soups, or they're just delicious. Hemp seeds are a really good garnish, and they're for 3 tablespoons is 10 grams of protein. So that's the kind of thing I'm looking for: high protein, safe protein. I was kind of hoping everyone might keep their eyes open, and if they find a more affordable source, I'd appreciate it. Bob's Red Mill hemp seeds are about $1.25 a serving. And so that's kind of inhibitive. And so if anybody ever finds a cheaper source of hemp seeds, they're super nutritious and high and low in everything we don't want and high in protein. So I'm almost desperate to find a cheaper source.
So Ken, I don't want to put you in this category, but I encourage you to read the book. Do you see it?
Yeah, protein.
Proteinaholic by Garth Davis. He's apologizing to his patients for telling them to eat too much protein. And I know that your doctors don't get it. And I know that they have created an environment in your mind that you're really afraid of wasting away. But let me tell you, over my 46 years, I've seen a number of people who've had treatment for prostate cancer or whatever cancer there is being treated, and they didn't waste away. In fact, my dad was one of them, and he lived to 98, and he danced until he was actually 99 and a half. And I wish I could say something that would reduce the worry, and it's hard because you got a couple doctors who keep banging on you to eat more meat because that's what their belief is. And I'm sorry about that, but I'd encourage you to read this book.
So I just ran across one interesting thing. We only need about 60. The normal person only needs about 65. I suppose that's an average sized man.
Correct.
65. But the average American, because they eat meat, gets 95.
Correct.
And that I understand that having too much protein can lead to heart situations.
Not only heart, but kidney disease. Too much protein clogs up the filter, causes inflammatory reactions. You have inflammation is produced by the meat that they're encouraging you to eat. And inflammation is something you don't want in your body. You don't want those free radicals from the meat they're telling you to get. And you don't have to overdo it on the plant protein. If you go to our classes, you can see the very first introductory class that I give, which compares 500 calories of plant products with 500 calories of animal products. And even though the bulk is a lot more with plants, the protein is identical. So just keep eating a variety of plant foods, eat enough calories, and you'll get enough protein. That is the bottom line. And you can ask John McDougall about it. He'll tell you that. You can ask Neil Bernard. You can ask Dr. Greger. You can ask Scott Wagnon, and you can ask Charlie Ross about it, and we'll all tell you the same thing. You get enough protein if you're eating enough calories in the day.
Okay, thanks.
And we'll even talk to your doctors if you want to set up an appointment with us. I'm more than willing to talk with them about it, if it'll help you. Okay, Velvet.
Hey, Ken, really quick. I did hear that Costco, if you buy the hemp seeds in bulk, they're cheaper. But I don't know. I haven't gone there myself to do it because those bags of Bob's Red Mill are expensive. So, FYI.
I'll have a daughter check it out because I don't go to Costco.
This is
I don't
the-
either. So,
This is the Costco bag. I get mine from Costco all the time. Not just for protein, it's a healthy ingredient.
It does.
It's
doesn't
for
say-
the omega-3s
Yeah.
that you're
Yeah.
eating that.
Eric, do you know
omega-3s.
how much that is?
I can't remember.
Okay, because the Bob's Red Mill is like $10 a bag and it's pretty small. I'll go through it in like a week.
It comes out to $1.20 a pound, Bob's Red Mill. Eric, doesn't it say 10 grams of protein per serving?
Yeah,
Yes, pretty high, and then that's a better thing. It's a healthy thing to use as a garnish as opposed to nuts, because it doesn't have as much fat as nuts.
right. The fat it has is omega-3.
So I'm just promoting that as a substitute for nuts, although I certainly eat probably more than I should. But I can afford it. I'm not trying to lose much weight.
Okay,
I'm trying not to lose muscle, and that's been a real chore. But what I'm doing it for, the hormone that's causing muscle reduction is working. And it's worked since the month we started it 18 months ago, the same time I started this program with you.
okay. Well, just remember, get enough resistance exercise because that helps build your muscle, and just, really focus on that aspect. Okay, Velvet.
Okay, so I'm trying to take this calorie density thing serious because I'm not getting the results I want. So I have questions.
Okay,
So I either usually like my go-to for breakfast is oatmeal or smoothies. If I'm working, then it's smoothies because it's easy to make and just go with me. So I have been adding like hemp seeds and flaxseed into my smoothies and in my oatmeal as well. I add a little bit less into my oatmeal. But with smoothies, I'll add the 3 tablespoons of hemp seeds, tablespoon of flaxseed. And that's obviously on the nuts and seeds in the middle category.
correct.
So should I really be doing that, or should I focus on just eating the fruits?
1 tablespoon is
Yeah, so-
probably adequate.
So I do 1 tablespoon flaxseed and then the 3 tablespoons of hemp seed. So just 1 tablespoon of hemp seed.
Or a tablespoon of flaxseed, or a half a tablespoon of flaxseed and a half a
So either
tablespoon
or.
but a total of a tablespoon.
Okay. I think also what I was trying to do is keep myself fuller for longer. I've also been lifting weights since January, December. And I'm doing yoga twice a week, and I'm
Good.
committed to walking 30 minutes a day. So I'm doing all these things, and I do need to eat more calories because I am lifting weights And I know I'm not focused on protein or anything, so don't worry, you don't gotta make me read the book.
So if you need more calories, you eat more beans, you eat more rice, you eat
Yeah.
more potatoes, you eat more of those, but their calorie density is down to 400 to 600 calories
Mhm.
a pound versus the seeds, which are 2,500 calories a pound.
Yeah, so with I guess with oatmeal, that falls under whole grains.
Yes, it does.
Okay, so I feel like when I eat oatmeal, if I don't add stuff in like some nuts or something, I get hypoglycemic. Like I feel sweaty and I don't feel well, and I find myself like finding something quick to eat because I get in that state. So I was trying to keep myself leveled out.
Are you eating beans with the oatmeal?
No.
See, so that's what I choose to do. I follow
Mhm.
Dr. Greger's Daily Dozen, and he
Okay.
has 3 servings of legumes a day with half a
Mhm.
cup. So for every breakfast, there's beans. He has 4 servings of fruit, so I have 1 or 2 servings of fruit, maybe 3 for breakfast. Then I have oatmeal, which is a couple servings. I only eat a couple meals a day, but I incorporate the whole grains, the legumes, the veggies, and the fruit all at one meal, and you'll have so much fiber that
Mhm.
it will distribute the sugar slowly, and you're not going to get hypoglycemic with eating more food.
Okay. And how does that look for you, Charlie? Do you eat the beans on the side, or are you mixing them in with your oatmeal?
So I put them in a separate dish
Okay.
because that sounds kind of gross, eating beans and
I
oatmeal.
was wondering, you never
However,
know.
however, a lot of people eat smoothies and put them together, and it's not really a big deal.
Mhm.
So, you know, your taste buds get used to whatever you choose to eat over time. It was just like I didn't like eating the 3 handfuls of greens that I probably have in the morning. I has started out with a baby kale leaf, you know, and gradually kept increasing. And you could do the same thing where you do a couple tablespoons of beans with some of the greens with you know, I eat the fruit separately.
Mhm.
And then I have the oatmeal, which is separate. My wife has the oatmeal with blueberries and a quarter cup of walnuts. So, you know, she likes hers together. I like mine separate. So whatever you choose, however you want to do it, but we eat them around the same time to really get filled up, and it lasts a long time.
Okay.
And I would say if you're short on time and you didn't have time to eat all that in the morning, you
Mhm.
could always just eat it when you start to feel that way a couple hours later. I'm assuming it's an hour or 2 after you've eaten that you start to get that way. Just eat have another piece of fruit as a snack. And then as far as your calorie density, I guess I didn't see too many problems with the breakfast that you described as far as calorie density. So I would be more focused on other snacks, lunch and dinner. Maybe there was some room for calorie density lowering in those meals.
Mhm. I mean, snacking for me is mainly fruit.
Yeah.
That's my go-to all the
Okay.
time.
So how about lunch and dinner? You're not getting the results you want. Are you eating out other
No,
people's food?
so lunch is mainly leftovers from dinner the night before.
Yeah.
So tonight we made pad thai, which was like brown rice pasta, which I have a question about that. And it's from the Plant You cookbook, so no oil, and it's like got tofu, egg in it, and some carrot and onion. And then I had a big salad on the side, like before I ate that, with homemade dressing that I made. But again, there's my other question. So like tahini, that falls in nuts and seeds. So I had to like change up my whole way of making my dressings. I feel like. So it's a work in progress.
It is.
I guess pasta though is on the lower thing, but all pasta isn't equal.
No, it's not.
I mean, so I did brown rice pasta, but I was looking at the back and the carbs and the fiber are not, I did your little math. So I usually use whole grain pasta, which is fine. Like, yeah, whole wheat pasta. So it's just, I'm still learning.
Yeah,
And it's hard
so
with and it's hard with pasta because, you know, even though, yeah, the 5-to-1, it might not make the 5-to-1 rule, but the reason that pasta is only 600 calories a pound in general and bread's 1200 calories a pound is because the pasta, you know, absorbs water and the bread's dry. And so that's why you get a little bit lower calorie density with the pasta. But like Jeff Novick shows in that video, you maybe have a smaller portion of pasta and a larger portion of vegetables, and then that'll lower the calorie density of the meal.
Yeah, and that's what I'm trying to do is like do like a 50-50 plate type thing. So like have, you know, a good amount on a plate, just fresh vegetables or cooked vegetables, whatever. And then, you know, whatever dish we're having, depending on what it is, you know. But a lot of the times our dinners are like rice and beans and like taco bowls, that kind of thing. So it's not, you know, I'm not eating horribly, but there are a few things I feel like I need to tweak.
Sounds good. Yeah.
So there is another option. There's Lisa Chick that you could talk with for a few minutes also.
I have been talking to Lisa. I met with
Okay.
her a week or two ago. So
Great.
and I will again.
Great, because she has helped other people to kind of navigate through some of the barriers that, you know, can
Yeah.
get in the way.
I just come up with these questions and I'm like, I'm gonna go pick Charlie and Scott's brain and then
Good.
go back to Lisa.
Good. We love that.
So,
We're really
thank
happy
you,
to
guys.
have you.
Could I add something for Velvet?
Yes, Beth.
In the group I was talking about with Chef AJ, well, she doesn't run it anymore, but it's one thing I learned from that is they actually have a saying like vegetables for breakfast. And so originally it was greens for breakfast, but people had a hard time with that. So just starting with even just vegetables, and then you know, people talk about their big salads and their greens and the various things they add to them as their first breakfast, and then the second breakfast would be like the oatmeal, like the wet starch with the berries and, you know, whatever you want to add. But so that was really interesting. Kind of start with the least calorie dense food, and then work your way up to the more calorie dense, still within, you know, maybe under the to the left of the red line, so to speak. You've probably seen those charts. So that was just really helpful stuff that I learned from that group.
Thank you, Beth.
Yeah.
Okay, if someone else has something to add, you can chime in like Beth does, but next we'll go to Dave and Sri. Can unmute and we'll be standing by. Hello.
So I've heard about the oat groats, so I finally got some on Amazon.
Yeah.
They don't have a recipe on them. Is there an easy way to make these?
I can tell you what I do in my Instant Pot.
Okay.
Yeah, so I make enough for the week, and so I do. So you know, if you have, do you have an instant pot?
Yeah.
Yeah, so it's so I take 2 cups of oat groats and I put it in a mixing bowl because you need to rinse them. So then I rinse them in a mixing bowl and just kind of drain the water off, and then I put that into my Instant Pot. So 2 cups of dried oat groats that have been rinsed, and then it's 3 cups of water, and then you cook it for 40 minutes on, you know, pressurize it and cook it for 40 minutes, and then it does a slow release for 30 minutes, and it comes out perfectly. So it's basically, yeah, you can. There's the water grain ratio, but so if you did 2 cups of dried oat groats, then that would be 3 cups of water. And then I think I once did 3 cups of groats, and that was 4.5 cups of water, because but I found that one on the internet, YouTube or something, on cooking oat groats. So that's what I do, and it comes out perfectly every time. I just cooked some more this morning.
So do you cook each batch right before you eat it, or do you cook it ahead of time and save it?
Sometimes most of the time I'll cook it and eat some that morning and then save the rest for the rest of the week. But today I actually had some muesli from some Bob's Red Mill muesli for breakfast with a banana in it. And I didn't make it in time to like, oh, I'm hungry. I want to eat the muesli now. So then I just cooked it for the week. So I'll have it for breakfast two or three other days this week.
So will it hurt you to eat a raw groat?
Oh,
I've
it would
never
probably
tried.
break your teeth.
Yeah.
I like them, but just,
Do you? You like
Yeah.
them? You can eat uncooked oats. So I think that you could eat uncooked groats.
okay,
But
Oh.
like Scott says, watch your teeth.
yeah. So, I've been watching everything for the 5-in-1 rule, but these are, what are they? 6-to-1.
Not to
Yeah,
worry.
and that doesn't really count. So when we do the food label reading class, I'll reinforce that, but that's only for processed food. So when you're looking at a oat groat, which is that's a whole food, that's a whole grain. It doesn't really count as reading a food label because it's just an oat groat. So you don't really need to use the 5-to-1 rule unless it's something that's been processed. It's just a way to say, okay, how much of the original food is left here? How much fiber does it still have in it? How processed is this food, like a bread or a cereal or a chip or something like that? That's where the 5-to-1 rule applies. But when you're looking at a rolled oat or an oat groat or farro, brown rice, bulgur, amaranth, all these ancient intact grains, that 5-to-1 rule, you don't need to pay attention to that when it's a whole food, just a processed food. Does that make sense?
That makes sense, yeah.
Yeah.
Okay.
Great questions. Anything else?
You have any more? Not right now. Let somebody else talk.
Okay, and you can come chime in later on. Doug and Evie next. Thank you.
I'm sorry.
That's good.
I'm 5'10", 79 years old. I used to weigh 152. I started losing weight. I was on whole food plant-based because of abdominal aortic aneurysm and pre-diabetic. No longer pre-diabetic because of this diet. My cholesterol has gotten better. They put me on cholesterol medication, but I didn't seem to be able to tolerate it. And anyway, I started keeping track. I was eating 2,500 calories a day on whole food plant-based and still losing weight. I went from 152 down to 128. I assumed I had cancer. They were testing me apparently for that, didn't see anything. And then I see a neurologist and he asked me how I was doing. I told him and he ran some tests and it's apparent that I likely had celiac disease. I had been eating a lot of oatmeal and that can be cross-contaminated with wheat, with gluten. And anyway, I just want to mention, I'm trying to gain weight, so I have a large meal, but people talking about what they can eat for breakfast. My standard breakfast is I chop up some mushrooms and some garlic, put a little water in it, stick in the microwave for a minute, and I add a handful of greens, cook it for another minute, and then I add half a can of beans, usually black beans or pinto beans, and then quite a bit of cooked brown rice and turmeric and some salt and pepper, and stick it in the microwave, warm it up, and I love it. It gives me everything I need, and it's non-gluten, and my weight's gone back up to 146. So apparently
That's great.
I do have celiac disease, and it's a good catch by the neurologist who, I was seeing him for a Botox injection. So my regular doctor didn't catch it. It's, they've run tests, random tests on people, and the majority of people, like there's a large percentage of people who have it and it isn't diagnosed. It's a very hard disease to diagnose, apparently. And, it's so rare.
Well, thanks for sharing that story. We'll put that in our memory banks for people who are losing weight, continuing like you were, and like you say, good pickup by the neurologist.
Yeah, very grateful. But anyway, that dish, I love it, and it's got pretty much everything I think you ask us to eat. And it's very quick, very easy. I cook up a batch of brown rice and open up the cans. I gotta start cooking the beans from, dried beans, I guess.
It can
That's an
be
amazing
fun.
breakfast. That's good.
I really enjoy eating it. Now, like I say, I have it every day and I don't get tired of it.
Well, thank
That's
you,
all.
Doug.
Yeah.
Doug, there is some oats by Bob's Red Mill that are not cross-contaminated.
Yeah, I'm aware of that, but I still a little leery of that. I inadvertently ate some what was that?
Morningstar.
I ate Morningstar plant-based sausage, and 12 hours later, I was moaning and groaning, and I won't go into other issues I was having. And my wife looked up the ingredients. The number 2 ingredient after water was wheat gluten. So that confirmed my celiac disease, I think. But anyway, I've had some other things that are supposedly certified, and I seem to have had minor responses. So right now I'm being just super conservative. After, I get back to what I was before, then I'm going to start, expanding into some of these other things, because I did enjoy eating oatmeal.
Thank you.
Thank you, though.
Thank you. Shirley, we'll get to you next, Kim, but Shirley is having a little trouble raising her hand. It's down on the lower taskbar, but you can just unmute yourself and speak up.
Me, Kim?
Well, we'll go right after Shirley.
Okay.
We'll have her go first since she's having trouble finding. Did you find the unmute? You just click on the microphone down in the bottom corner, Shirley.
There you go. I guess I was going to say to the person who has a doctor that's recommending the consumption of meat. I was a meat lover for years, but I know after having my present physician and seeing how wonderful I feel on plant-based and all of the classes, that if I were to find myself in need of another doctor, finding a plant-based believer in my doctor would be the first criteria. So I think if I had a serious illness, I would be looking for a second opinion. That's it.
Thank you very much for that input. And Kim.
So I'm going to be a broken record again about Brol.
Okay, good.
Especially because I wanted to tell Velvet that if you add lentils, and I put that in a chat to you, but if you beef up or rev up or ramp up your oatmeal, then it's going to be a lot more filling, and it will be probably a lot longer to digest. So if you use whole grains. So I think oatmeal, same with me, oatmeal, I'm hungry like half an hour after, but if I have Brol, it lasts me all day. And I put it in my smoothies too. So if you want to do a combination, I use it for everything. I put it in my soups. I use it as a rice dish or breakfast or a bowl, like a Buddha bowl or, anything like that. So anyway, I would encourage you to, when you make it, just put lentils in them. I mean, it's not going to be as fast. So, it'll take a little bit longer to cook, but I was telling the class today at 2 that I use my rice cooker today to make my Brol, and it worked just fine. I had been using a slow cooker, and it took about 2 hours, but I used my rice cooker and everything cooked up just fine. So that's another faster alternative. So I just wanted to share about that.
Thank you, Kim.
Is Brol like a sweet thing or is it like a savory thing?
You can do whatever you want. It's savory unless you put bananas or whatever. So I use, if I have some pasta sauce, I'll put pasta sauce over it. So it's like a rice dish.
So you can do whatever you want with it.
Yeah. You can put it in a burrito. You can do,
I'm looking up the recipe now.
Yeah, it's Dr. Greger. It's in Dr. Greger's. But I add whatever grain I have. I have millet. I have farro. He just calls it barley, rye, oat, and lentil. But I add all kinds of other whole grains. So you can do that too. Whatever you have at hand.
Kim, are
And
you
how
on
do you
Facebook?
spell that?
BROL.
Kim, are you on Facebook?
I sometimes add go to the Facebook page. You mean
I
for
might
the
send you a
class?
message or something.
Okay.
Okay, thank you.
Okay, Beth. Thank you, Kim.
I was just gonna ask if, this is a totally different topic, but is pseudo gout caused by a poor diet? Because my father, who has type 2 diabetes, he is 85. So that's good, but he's 85, lives next door to me, type 2 diabetes, plus he has a pacemaker for AFib. He has had pseudo gout in his right knee 20 years ago, had some cortisone shots. That's been okay. But recently this week he had trouble walking. Now he's got pseudo gout in his left knee. And I asked the person who diagnosed him at the walk-in clinic if there was anything he had done to cause it. And she said no. But I just was curious if it's diet related because he does not eat well. And I try to get him to eat better.
It's calcium pyrophosphate crystals for pseudo gout. It's uric acid for gout, and diet definitely has an effect for gout, but I don't know of anything. Maybe Scott, you know of something, but I don't know of anything for pseudo gout in the way of food.
I would think, it's inflammation. So if you're on an anti-inflammatory diet instead of a pro-inflammatory standard American diet, you likely wouldn't have any flare-ups, even if you're predisposed genetically to form calcium crystals. Although we know that the reason that you have extra calcium floating around is because the calcium is too high in the blood, and so the kidneys get rid of extra calcium because we have to have a very tight window of how much calcium we have in our bloodstream. And so then, people on the standard American diet are peeing out calcium all the time because of that situation. So just by being on a more whole food plant-based diet, you won't be in that more you won't have that situation where you're peeing out more calcium. And then it's also anti-inflammatory, so less inflammation, less chance of having a flare-up. So both with gout and with pseudo gout.
And do you think there's a relationship there with sometimes he gets kidney stones and also he has a sponge kidney?
Yeah, definitely kidney stones. It's the same situation. Having calcium getting excreted from your kidneys, then you're more likely to form stones, calcium stones as well.
Okay, thanks.
Scott,
Oh, go ahead.
Yeah.
On the kidney stones issue, I had kidney stones too, and I'm watching the veggies I choose based on their oxalate content. And Harvard has a very good schedule that you can pull up, that PDF that you can pull up. It tells you what the oxalate levels in, and some of the foods that we are all talking about, some of them I stay away from. I stay away from spinach, which is a real high in oxalate, and I monitor potatoes. I don't eat too many, but and I do remember you told me a couple months ago, because I was taking calcium citrate capsules, and maybe to stop those. And I think the recommendation is now not to take them because it doesn't really help anyway, and to eat more calcium rich vegetables. So, because if you're eating it at the same time as you're eating the oxalate, it's more likely to bind and get rid of.
Right. So
I would
it
say
blocks calcium.
anybody who's got kidney stones issues needs to look at the oxalate levels of the various vegetables, because that's plants, because that's where the oxalate is in plants.
Yeah, the main three you want to avoid are spinach, Swiss chard, and beet greens. Those are the three highest in the oxalates. And so if you or someone that has problems with kidney stones, calcium, usually it's calcium oxalate, then you want to avoid those three. At least not eating too many of those three greens. But
And too many might be 3 handfuls, but a handful of
Mm.
spinach or a handful of
Right.
chard once a day is likely not gonna precipitate or, lead to kidney stone formation. But several
Yeah.
servings is potentially problematic.
And there's also no guarantee that someone won't get kidney stones, and there are health benefits to eating these foods. So there's a, you take a little risk.
Yeah,
Yeah.
so keeping yourself well hydrated is probably
Yeah.
one of the primary strategies of preventing recurrent kidney
Yeah.
stone formation.
Yeah.
But it is important to not overdo it. I've had a patient one time who was eating like 4 or 5 handfuls of spinach a day. He took Dr. Esselstyn's 6 time a day greens, but he used one oxalate green and he wound up with kidney stones. So when he stopped doing that, he didn't have recurrent one. Okay, Ken. This has been fun so far.
I hope I don't ruin it for you then.
No, you're not going to ruin anything, Ken. We love having you.
I kind of can reinforce some things. I'm kind of ticking a lot of things came up that I do. So let's see, Kim's the one that uses a rice cooker.
Yes.
I told you before, I cook everything in either a rice cooker or an air fryer. And so I use my rice cooker all morning. So I may not have perfect groats, but I have groats that are just fine for me. I just put a 1/2 cup of groats and 3 cups of water in the rice cooker for 30 minutes. But like I follow Beth's rule or what she does. That's in the middle of the morning that I have the oat groats, which is it's my muesli. I mix some other things with it. So I do the oats as my second breakfast and fruit. My first breakfast is what you guys got me doing 18 months ago, and that's in the rice cooker, greens in the basket, and beans in the pot. So I cook them both at the same time. So my rice cooker gets used. I make a ton of soup in it. So anyway, I'm just reinforcing things other people said. I was tickled to hear them.
That's great, Ken. Thanks for sharing it, because this gives people ideas, especially the newer people, on ideas for meals. This is kind of this open forum is great because we can cover all different kinds of topics.
Okay, so we've gotten through the hands up. That means a new group can put up their hands or ask some questions.
I wanted to ask about strength training. How does that
Yes.
figure in daily exercise or weekly exercise?
Yeah, so it's recommended to do strength training 3 days a week. So, on top of your at least 30 to 60 minutes, 30 minutes of moderate intensity exercise, up to 150 minutes per week. 150 to 300 is what's recommended. The 150 is the minimum. And so you can, however you want to do that, whether it's 10 minutes 3 times a day or 30 minutes once a day. That's as far as moderate activity. And then 3 days a week, it's recommended to get some what we call more resistance exercise. So whether that's little hand weights you can do, you could also do like sitting down in a chair and getting up and down in a chair. That would be considered resistance exercise. Exercise bands, you can go those little Penrose drains that you have, or the different exercise bands you can buy for your legs and for your arms. So anything that's going to create resistance and work your muscles, that would be. And then doing some stretching and flexibility. So whether that's Tai Chi or yoga or just doing some generalized stretching, that's recommended as well. But that's as far as just kind of what the medical profession says for minimum exercise and activity. And, you know, we say, yeah, activity is a better word for it because you don't have to go sweat at a gym or anything to get the health benefits from exercise. If you want, you can do more than that if you want, if you're trying to gain more cardiovascular fitness, but that would just be the minimum. That's all good for not only for your overall health, but also your bone health for prevent osteoporosis.
Thanks. And also, what does flax do?
So there's flax seeds, and we usually recommend flax meal. Dr. Greger recommends a tablespoon of flax meal a day, and it's a really good source of omega-3. So it's the omega-3 fatty acids that we need, and it's a really good for that. It's actually also been good for lots of other health reasons too, including reducing menopausal symptoms, the vasomotor symptoms. There's some data, randomized trials that show it could improve those symptoms as well. But yeah, mainly we recommend it for getting those omega-3 fats. But you can also get those from like walnuts and chia seeds and some other sources. But yeah.
Other sources like sea vegetables.
There you go.
Which would be dulse or wakame or nori, like the sushi wraps, those things. Doug.
It's actually Evie that's wanting something. I have a question.
Evie.
Historically, my blood pressure has always been very low. I've had blood pressure that's usually about 90/60, and very often it go down to like 80/45. And I do a lot of exercise. I'm a cyclist and, would do like 30 to 40, 50 mile rides. And, it's great. All of a sudden, about 8 months ago, my blood pressure went and, it's gone up to like 140/80 and 130/78. And I take it multiple times a day to just watch to see how different things affect it. The doctors have put me on blood pressure medication, and I can't figure out why. I don't know why it would have jumped up that quickly. And when I asked my doctor, his response to me is, he goes, well, your blood vessels are getting more rigid as you age. I'm 70, almost 73. So I'd just like to hear from the two of you, any suggestions? It makes me nervous to have my blood pressure this high, and I don't like taking the blood pressure medicine. And so I'm not sure what to do.
You say it was 8 months ago that it started?
Yeah, it was about 8 months ago.
Do you mind if I ask it, did you get COVID?
I did.
I've had
Oh
many patients. I don't know, I'm not saying this is the cause necessarily, but this is anecdotal evidence. There's no studies on this, but I've had so many patients that for several months, I don't know about 8 months, but for several months after they had COVID, their blood pressure really shot up. Whether they had high blood pressure before or not, they really increased it. And it seems like it tends to go down after a while. But other than that, I would just say, was there any change in your diet 8 months ago?
Not significant when the blood pressure changed, no.
Mm-hmm. So that's something to think about, but maybe it'll come down on its own. I guess just have to monitor your blood pressure, and if you start getting dizzy when you stand up, they might need to lower your blood pressure medicine if it starts to recover. But I don't know if you got anything else to add, Charlie.
Yeah, it looks like Shirley had the exact same results of after COVID at the same age group and everything. So the only thing that I would say is, was your blood pressure when they put you on blood pressure medicine, was it above 150/90? Because in age group, I think greater than 65, I know McDougall wouldn't treat anyone unless the pressure was over 150/90 initially.
No, it wasn't that high. The highest I've seen it is, it typically, sometimes it gets up to 142, 144 over 83, something like that. I haven't seen it at 150. That would totally freak me out.
So it would freak you out, but go to Dr. McDougall on the YouTube and look up McDougall and hypertension.
Okay.
and listen to what he has to say, and stop taking your blood pressure so often. You can kind of make yourself a cardiac cripple by chasing after this and the stress and the worry connected with it. Hopefully he calms you down, because it sounds like we're making a mountain out of a molehill.
And the data that Dr. McDougall uses for his recommendations is because there is a huge difference in different countries' guidelines. So we get different guidelines for treating blood pressure. So we have the JNC that tells us that's who basically tells us, you know, what blood pressures to treat and with medication versus lifestyle and this and that, to what levels and stuff. It's the JNC. I think there's one that's the 8th one now, JNC 8. And so that's what America uses for the most part for us medical providers. But if you look at like the data from the British Medical Journal and the Cochrane collaboration and there's different expert guidelines that come out for treating blood pressure. And, you know, Dr. McDougall follows the ones that are more over in Europe, because the ones in Europe tend to be, I guess, not to be controversial, but less influenced by the pharmaceutical industry, let's just say, and follow the science a little bit closer, where we get some influence in our treatment guidelines sometimes from not such great, great places.
Right.
So we treat it much lower, whereas like the British Medical Journal says, as long as it's less than 150/90, you don't really need to be putting people on medication. But here it's like 130/80, you're already starting to think about it, and so there's a big difference, because there's something called the J curve. I don't want to bore you guys, but basically the J curve, what it is as the blood pressure goes down with medication, your chance of dying from a heart attack or stroke goes down. But then when you get to a certain level, like below 120/80, you start to increase your risk of dying of a heart attack or stroke. So it starts to cause harm. And so there's something we call the J curve. And so there's risks to overtreatment as well. And so that's why we really try to focus on diet and lifestyle, because that's treating the cause. And because people in there, you can go to the blue zones, for example, where the rates of things like diabetes, heart disease, cancer, dementia are really low, little to none. You know, someone in their 90s has a blood pressure of 110/70. So we know that you don't have to, it's not normal for your blood pressure to go up as you age. There's something wrong if it does, because if you look at populations that don't get heart disease, their blood pressure is just as low at age 90 as it was at age 20. And so because we used to call it essential hypertension, because we thought that as people age, they need to have higher blood pressure to perfuse their brain and their organs and things like that. So we thought that was why that is, but we have since realized that's incorrect. It's actually because the longer you live the standard American lifestyle, including the standard American diet, the higher your blood pressure gets, because your arteries get sicker and sicker and they get stiffer and stiffer.
Okay. All right. Well, thanks for the input. I appreciate it. And I'll look up Dr. McDougall and hypertension.
Very good.
Good.
Thank you.
And if you have problems, send us a note and we'll point you in the direction.
Thank you so much. I
You're
really appreciate you guys in this class. It's very, very beneficial and helpful.
Right. Thanks for speaking up. Arun. Just go ahead and unmute first.
Thank you. Now you can hear me, right?
Yes, we can hear you now.
Okay, so I have part one. The lower part of the blood pressure, it's more like 60 or 70. And
Okay.
second, the pulse, heart rate, it's more like 45 or around that. Is that a problem?
Are you feeling good?
Yeah.
It's not a problem. You'll live a long time. Your heart is not beating as fast as people who have, I don't know, more stress in their life or whatever. And your blood pressure sounds like it's pretty good. What's the top number?
Oh, it goes between 120 to 135.
Yeah, so sounds
This is
like you,
with- Yeah, with little medication help.
so, oh, so if you're on medicine, if you listen to Dr. McDougall's hypertension, you may be not needing as much blood pressure medicine.
Okay, all right.
And then are you on a beta blocker like metoprolol or propanolol or carvedilol, anything like that?
No, I'm taking, let's see, Maxide, and I'm taking lisinopril.
Okay. Yeah, neither of those would slow your pulse, so that's good. Because when you said your pulse was in the 40s, if you were on a beta blocker, that slows your pulse, and it might be slowing it too much. But you're not on one of those, so it's fine.
Right, and when I'm, like walking fast or going uphill, or on the machine, it goes up to 120, 130, the heart rate. So that's not a problem there, yeah.
No, it's not a problem.
Okay, thank you.
But I would, yeah, it sounds like you're on a fair amount of blood pressure medicine, 2 pills.
Oh, yeah, but they're small, like 10 milligrams of one and 25.
Right. So, me, what I would say, if you're taking pills, there may be something you could do to tweak your diet. And instead of doing just the vegetarian, do a bit more on the totally plant-based, and you may be able to get off of those.
I'm working on it. I got it. Well, you see, my wife, her heart rate is like almost 85 or so, like 80, 85. And she doesn't have high blood pressure problem. So I got to put up with whatever she cooks. But I
see.
I bring in a lot of salad, in the diet, yeah.
We need to bring her to these classes and talk to her about.
Right. Well, she's working evenings now from 4 to midnight.
Okay.
That's the issue. Yeah. But thank you. Yeah.
You're very welcome. Nice seeing you.
Namaste. Thank you.
All right. Who else? We're having fun tonight, for sure. No doubt about it. And one comment that I do want to make, I noticed that when people have high blood pressure, they are taking it day in, day out, multiple times a day. And every time they're taking their blood pressure, they're getting upset, kicking out adrenaline, causing their pressure to remain higher. And so, it's best, unless you're having pressures up in the 180 over 110 range, to kind of give yourself a little bit of break. Take it once every few days, once a week, but several times a day, I surely wouldn't recommend. Just my thought.
Charlie?
Yes.
Hey, it's Mary Ellen here.
Mary.
Hey, I just thought I'd report. I really enjoy listening to everybody and what's happening, but I think last time I saw you guys, I told you that I was kind of freaked out that my morning blood sugar dropped to 94, and it kind of freaked me out. So I took it again the same morning, but I've had like 10 or 12 days now of normal, down around 100 blood pressures. And that, you were talking earlier about not thinking negatively, not letting things get you down. And it sure makes a difference when you're making progress in the right direction to do better and be stronger, to eat the right things and do the right thing. So I've been able to bring my insulin down a unit every day so far.
And congratulations. What change happened that led to you getting this under much better control?
Well, that's the thing. I really don't know. When the change happened, I thought about the day before. It's like, what did I do differently the day before? And I really can't put my finger on what it is. I eat a lot of fruit. Fruit is my go-to. If I'm eating because I'm bored, or if I'm eating because it's habit, or if I'm eating because of whatever, I tend to eat fruit. And I remember the first doc I talked to when I was diagnosed with diabetes and my A1C was 14. She said, I told her I was going to just go plant-based instead of insulin. And she kind of ridiculed me and said, well, for God's sake, don't eat fruit. The second thing she said to me was, where will I get my protein? And this is a doctor. She's really a smart doctor. She knows nothing of nutrition, but she's brilliant in other ways. So I don't want to name her. But at that point, I thought to myself, I got to get out of here or she'll kill me.
Well, it sounds like you had recovery of your pancreas function to have this. You've been doing this now long enough that your pancreas is finally recovered to be able to, and your insulin resistance is dropped down to the point where you're having normal blood sugars.
Well, it's
so
exciting.
congrats to you.
It's exciting. And I do eat bread. That's all I have to say.
Okay.
Thank you, guys.
Hey, thank you for the input. Dave and Sheree.
I just want to say, a couple of years ago, I went on blood pressure medicine. I got one of those little cuffs.
Yeah.
I took it like 4 times a day to see, and it just kept popping around. I finally just gave up. It's like, if I take it at this one time, it looks great. I take it this other time, it looks terrible. It's just random chance when you take it.
You're chasing your tail, like a dog chasing its tail after a while.
And, I hear people a lot say the things, talk about the things they're giving up. And, when I started this, all I can say is the first 2 weeks are the hardest. And I had to have my weight be so high that I gotta do something. And so, but once I got through the first 2 weeks and I had lost weight, it's so much easier. And I don't think about I'm giving it up. It's like, I don't want that anymore. I've lost 40 pounds. I don't want to go back again. I've done it before. I don't want to go back to being that way again because I feel so much better now. And on occasion, the kids will have a birthday cake and I'll eat a little piece. And it's like, I wish I hadn't. So I guess if you can get away from thinking about giving up versus changing, that would probably be really helpful.
Well, that's really helpful for the people, for many of the people here in these classes. So thanks for sharing that.
Yeah.
Arun.
Yeah, I wanted to ask, is too much exercise bad for me? I'm in my 70s. So on the average, I'm doing about 9,000 steps. I swim 3 times a week. And sometimes, most of the times when I'm going hiking, I'm probably logging in between 10 and 15,000 steps. So is that, I'm doing it only for one reason, because I want to lower my blood pressure and, keep in good health. But is that going too much or it's okay?
If you're not having chest pain, you're not having shortness of breath, you're not having symptoms of any sort, you're otherwise feeling good, then keep doing it. That's my thought process. And, everybody has a different exercise tolerance level. And if you're otherwise feeling good,
okay.
I don't know. Scott, do you have any other thoughts on it?
No, just exactly what Charlie said, and just like the Blue Zone people, just moving throughout the day. Just just keep those. Don't sit. You don't have to do a necessarily, other than the minimum of the 30 minutes is what we recommend. But it's also not good to do 30 minutes of exercise a day and then sit the rest of the day either. So you just want to be moving. Just always that activity thing, just moving throughout the day, whether it's puttering around your house, cleaning your house, gardening, working on things, projects, just moving around, just constantly moving is always a good idea.
Yeah, right. And I do that, morning walk, evening walk, couple of bike rides, going to work on bicycle, coming home on
Nice.
bike,
Wow.
and
Great.
swimming.
Keep doing that.
Okay, thank you.
Charlie, can I say something?
Yes, Trouty.
Wondering how much is 10,000 steps? How many miles or how much is that?
Oh,
The
about 5 miles, 4.5 miles.
A half a mile?
4.5, yeah. 4.5 to 5 miles.
1.5?
4.5. Four.
Oh,
4.5 to 5
Mi-
miles.
Whoa. Once a week I get this. And lots of times it's 6 to 7,000. Yeah. So yeah, it's pretty good then. That's in one day.
Yeah.
That's pretty good. And I do walk some of it, yes. But mostly around the house, so yeah.
Yeah.
Okay, Shirley, or let's see, Donna.
I am taking a diabetes prevention class at the YMCA. And they're talking, they said what Scott said earlier about exercise. They're encouraging us not to count steps, rather count minutes of how much time we're spending in the moderate range, where we can still talk, but we can't sing. So getting our heart rate up in the 150 minutes a week in moderate range. And specifically when we record our time, or log our exercise, they don't want us using the steps, because we have steps on our phones, all of us. And I get 10,000 often, but I definitely don't get enough moderate exercise. So I have to just wanted to mention that.
Okay.
Yeah, thanks for sharing.
And remember, you really can't out exercise a bad diet. So if you really want your best health, you want to really focus on doing very strong, vast majority of whole plant foods in your diet. And then you also do want to incorporate moving throughout the day for your best health. But if you had to pick one, it would be making healthy food choices as the very first strategy.
Has anybody in the class been attending the health, the Truth About Weight Loss Summit with Chef AJ?
I went to one, but I was bummed that it wasn't like I couldn't turn off my phone and like listen. You know what I mean?
Oh,
I
right,
had
yeah.
to keep my phone on. So it was really hard to I'm like, that's like 3 or more hours and I can't.
Yeah,
I
I know.
have children, I have homework to do, and it would be nice to listen to it like on a walk or something.
Right.
But so it was really, I wish they would do it differently, but I'll write a review or something.
Yeah, write her a note.
I'm like,
Beth?
I can't sit there for 3 hours to listen to that.
Yeah, this is my third year or second year with it. 1 year I bought it. Yeah, I don't have that much time either, but I think I almost think that's why she has 3 or 4 speakers a day, because then you kind of have to purchase it if you want to really like hear them all, unless you're retired or have the time, but I always enjoy it, and it's always uplifting and inspirational, and I always learn something new. But I don't think I'll purchase it this year, but I am missing it. Like on Saturday, I was like, oh, good, I can do this. And then Sunday, I'm like, I can do this. And then Monday, when I went back to work, I'm like, I can't even do this. But it's great. I wish I could purchase it, but I don't think I will. Has anyone else? Have you, Scott?
Yeah, I've listened to quite a few. I actually had the benefit of having a 4-day weekend. I took a vacation day yesterday. So I'm always off on Tuesdays. I work 4 days a week. And so then so the last 4 days I've gotten to listen to most all of them, because if I don't catch them live, they do, they can listen to the recordings later and find that a little bit easier because I can stop it whenever and restart it. So I've caught probably 2/3 of them over the last 4 days, but now the next 3 days I work, I won't be able to, probably won't have time to, maybe I'll listen to a little bit in the evening. But they're good. I mean, it's I try to listen to lectures that I haven't necessarily seen before, just to see what other things they got to offer there. So it's good. It's always good.
Okay, Lisa, it's time for you to unmute and tell us about the book club this week and what you have planned and those sorts of issues.
Hi, everyone. The book club will be meeting for the second time on Thursday at 7 o'clock. So we're going to finish talking about the Mayo Clinic Guide to Stress-Free Living. And our new book has been decided for probably for March, April, and May based off of feedback on the amount of reading. So that book is going to be Salt, Sugar, and Fat. And everyone's welcome to join. It's okay if you didn't finish the reading. You can still get something out of it. You're not getting graded. I know that's always terrifying. And it's been pretty fun so far. I've gotten a lot of great feedback about how much everyone enjoys the diversity from everyone's different backgrounds. So really, you all are making the book club all the more valuable. And other than that, I'm always here for one-on-one health coaching. I've seen a few more faces recently in my one-on-one sessions, so it's been a lot of fun. And if my times don't work for you, I can always set up something else. And other than that, that's it.
Okay, that's great. That's what we're looking for. Just want to give you a little time to share what you want to share. Facebook is up to what, 340 participants now. Pretty amazing.
And we got I mentioned at the beginning of class, but not very many people were logged in yet. So we have the movie social coming up on Saturday at 2 o'clock at the First Christian Church of Springfield, and we have 48 people signed up right now. So it's going to should be a great event. And then next week's class, I'm going to be talking about food addiction and behavior change, and that's what's coming up on my end.
So let's see if we have any last questions, for the good of the order. If there's anybody who has anything they want to add or subtract, now's the time.
I have a question.
Yes.
I know that simple carbs, like unhealthy carbs, can turn to sugar in your body. I'm just thinking in terms of my dad with type 2 diabetes, but is it still, so if he has too many carbs, then it can turn into sugar for him. But if it was complex carbs like whole grains, is that the same issue?
No.
No, so
Trouty, congratulations.
Yay.
It is not the same issue. Good job. Go ahead, Scott.
Yeah, just the analogy I always like to use is your complex carbs, your whole plant food. So fruits, vegetables, beans, intact whole grains, nuts and seeds. Those are all, most of the calories for most of those foods are carbohydrate, but those are, that's just macronutrients or carbohydrates, protein, and fat. And so that's where we get our calories from, but macronutrients are not foods, but still, to answer your question, it's those complex whole plant foods. That's like a block of ice versus refined carbohydrates. So, white flour, white sugar, processed. So chips, cookies, crackers, things like that, white bread, things like that, even whole wheat bread. You could consider those foods, those are the refined and processed carbohydrates, because that's where most of the calories come from, or carbohydrates, which, like you said, turn into sugar. I mean, all food turns into sugar eventually, but it's how fast or slow they turn into sugar that's the issue, especially with diabetes. And so whole intact carbohydrates, whole grains, and fruits and vegetables and beans, that's like a block of ice sitting on your front lawn on a hot summer day. it's gonna melt, but over a slow, long period of time. Whereas those refined processed foods, carbohydrates, would be like shaved ice. And so if you throw shaved ice on your front lawn, it's gonna melt really quickly. And so then it's gonna raise your blood sugar really quickly because it gets absorbed so fast. And so that's a good analogy to always think about, is if it's a whole plant food, it's gonna be really good for you, even good for diabetes, because it's going to raise your blood sugar slowly, not require very much insulin. When it's a refined and processed food, it's going to absorb really fast, raise your blood sugar really fast, require a big surge of insulin. So, so yeah, that's the good way to think about it.
Thank you.
You're welcome. We'll have a class on diabetes coming up in, I think it's in April when we do the diabetes classes.
And in the meantime, you may want to refer to the archive sessions on diabetes over the last year or two.
Yeah, you can look at the 2022 classes and go back to last spring and watch that now if you're curious about that.
All right. It looks like this was an hour and a half. That kind of flew by again. It was great fun talking with all of you. We loved the questions from all of you. Scott, that was pretty amazing tonight.
Yeah, it was really fun. Lots of diverse. I used to kind of do a theme on the website as far as what we talked about in the open forum, but the last couple open forums have been so diverse. I just keep it saying open forum.
Yeah, that's great. All right, everybody. We'll see you next time around, and enjoy your week.
Thank you.
All right, everybody. Good night.
Good night.
Night.